In our last video, we showed you how type 2 diabetes silently destroys your kidneys, your eyes, your heart, and your brain. Thousands of you commented one word: reverse. So here it is. The video you've been waiting for. Because here's what your doctor might not have told you: type 2 diabetes is not a one-way door. Unlike almost every other chronic disease, this one responds directly to what you do every single day. Food, movement, sleep, stress. In the right combination, your blood sugar can normalize. Your cells can regain insulin sensitivity. Your pancreas can recover. People have done it. The science backs it. And today, you're going to learn exactly how. Quick recap from last time, because to fix something, you need to understand what broke. Type 2 diabetes happens when your cells stop responding to insulin, the hormone that unlocks your cells so glucose can enter. Your pancreas keeps pumping out more and more insulin, trying to force the door open, until eventually it burns out. The result? Blood sugar stays dangerously high, 24 hours a day. Now, here's the key insight most people miss. Insulin resistance didn't happen overnight. It built up slowly, over years of habits. Which means it can also be reversed slowly, over months of better habits. Your biology is not your destiny. Let's get into it. Strategy number 1, and the single most powerful lever you have, is what you eat. Now, before you roll your eyes, this isn't about starving yourself or going on some extreme detox. This is about understanding which foods spike your blood sugar and which ones don't. Cut the blood sugar bombs. White bread, white rice, sugary drinks, candy, cereals, pastries, these convert to glucose almost instantly. Every bite sends your blood sugar rocketing. Your pancreas scrambles. Insulin floods out. And your cells become even more resistant over time. Replace them with what we call low glycemic foods, foods that release glucose slowly and steadily. Think vegetables, legumes, whole grains, nuts, eggs, lean proteins, healthy fats like avocado and olive oil. Timing matters too. Eating within a shorter daily window, what's called time-restricted eating, gives your pancreas a genuine break. Even just a 10 to 12-hour eating window has shown meaningful improvements in blood sugar control in U.S. clinical studies. One rule that changes everything: eat protein and fat before carbohydrates at every meal. This simple order change slows glucose absorption dramatically, and it costs you nothing to implement. Within weeks of dietary change, many people see fasting blood sugar drop by 20 to 40 points. That's not a miracle, that's biology responding exactly the way it's designed to. Strategy number 2, movement. Here's something that will blow your mind. When your muscles contract during exercise, they can absorb glucose from your bloodstream without insulin. That's right, completely bypassing the broken key unlock system we talked about last time. Exercise is essentially a back door into your cells. The most effective types for blood sugar control? Walking after meals, even just 10 to 15 minutes after eating, dramatically reduces the post-meal blood sugar spike. This is one of the most underrated interventions in diabetes management. Resistance training, lifting weights or bodyweight exercises 2 to 3 times a week builds more muscle mass. And more muscle means more glucose gets absorbed from your blood all day long, even while you sleep. Zone 2 cardio, moderate intensity aerobic exercise like cycling, swimming, or jogging for 30 minutes, 3 to 5 times a week. This specifically targets the metabolic pathways that improve insulin sensitivity at the cellular level. You don't need a gym membership. You don't need equipment. A daily 30-minute walk, done consistently, has reversed prediabetes in clinical trial after clinical trial in the United States. Strategy number 3, and the one most people completely ignore: sleep and stress. Remember cortisol, the stress hormone from last video? Here's what happens when you're chronically sleep deprived or stressed. Cortisol floods your system. It signals your liver to dump stored glucose into your bloodstream, as if you're in a life or death emergency. Your blood sugar spikes. Your insulin resistance gets worse. And you didn't even eat anything. One bad night of sleep, less than 6 hours, has been shown to cause the same degree of insulin resistance as eating a high-fat diet for 6 months. Let that sink in. So the fix is just as powerful. Aim for 7 to 9 hours of quality sleep. Make your room cold, dark, and quiet. Cut screens 60 minutes before bed. The blue light suppresses melatonin and keeps cortisol elevated. For stress, even 10 minutes of deep breathing, meditation, or a walk in nature measurably lowers cortisol levels within the same day. The Diabetes Prevention Program, the largest diabetes study in U.S. history, found that stress management alone improved blood sugar control independent of diet and exercise. Your nervous system is a metabolic switch. Calm it down, and your blood sugar follows. Strategy number 4, working with your doctor. Let's be clear. This video is education, not medical advice. If you're on diabetes medication, do not stop taking it without talking to your doctor. Some medications like Metformin are not only safe, they actively support the lifestyle changes we're talking about. But here's what the science shows. When people commit seriously to diet, exercise, sleep, and stress management, many are able to reduce their medication dosage. Some, with their doctor's supervision, are able to stop medication entirely. The key tools to track your progress. HbA1c test. This is your 3-month average blood sugar. Below 5.7% is normal. Between 5.7% and 6.4% is prediabetes. Above 6.5% is diagnosed type 2 diabetes. With lifestyle intervention, many people drop their HbA1c by a full percentage point or more within 3 to 6 months. Continuous glucose monitor, CGM, wearable devices like the Freestyle Libre or Dexcom let you see your blood sugar in real time. Watching how specific foods, walks, and sleep affect your numbers is one of the most powerful motivators for behavior change. Know your numbers. Track your progress. Partner with your healthcare provider. This is a team effort. Now let's talk about what's actually possible. The direct trial, published in the Lancet, followed people with type 2 diabetes through an intensive dietary program. After 12 months, nearly half of participants achieved full remission. Blood sugar normalized. Medication stopped. The U.S. Diabetes Prevention Program found that lifestyle changes were more effective than Metformin at preventing diabetes progression. These aren't outliers. These are peer-reviewed clinical trials with thousands of American participants. And it's not just the numbers. People report more energy, clearer thinking, better sleep, less pain in their feet and hands, vision stabilizing, losing 10, 20, 30 pounds, not because they were starving, but because their metabolism started working again. One man from Ohio, 54 years old, reversed his type 2 diabetes in 8 months through walking, cutting processed carbs, and fixing his sleep. His doctor took him off both his diabetes medications. This is real. This is happening. And it is available to you. So let's bring it all together. Type 2 diabetes is reversible, not with magic pills, not with expensive procedures, but with 4 strategies working together. 1. Fix what you eat. Low glycemic, protein first, time restricted. 2. Move your body. Walk after meals. Build muscle. Do cardio. 3. Sleep deeper, stress less. Your hormones run your blood sugar. 4. Partner with your doctor. Track your HbA1c. Know your numbers. You have more control over this disease than anyone ever told you. And this is just the beginning, because next, we're going deep on the exact meal plans, the exact workout routines, and the exact sleep protocols that are working for real people across America right now. If you want to know exactly what to eat, how to move, and how to sleep your way out of type 2 diabetes, subscribe and comment to MedAtlas.